suicide is a major public health problem, and it disproportionately impacts American Indian Alaska Natives. We believe that the best way to promote health equity is universal screening. So you're asking everybody. You're not doing targeted screening where you're just saying, I'm going to ask you, but not you. I'll ask you. You know, the Joint Commission says that you should ask people who are there for behavioral health chief complaints. But, you know, how do you know someone doesn't have a mental health concern? We don't know. People don't walk around with like, I'm a behavioral health patient, or everybody has mental health concerns. So we think screening everyone and asking directly is the best way to get to that. And then the way to, you do so much, you're so busy on the front line. So we don't want to overburden you. So we have these clinical pathways that starts out, you're going to hear me say this over and over again, but the 3-tiered pathway starts out with the brief screen, and then it follows up with a brief suicide safety assessment, and that determines what happens next for the patient. And this clinical pathway, which can be done 100 different ways, and the nuance is important, this clinical pathway is what makes it feasible. So let's just look at the numbers, the epi, very briefly. It is the 9th leading cause of death among natives, and which represents about 4% of all deaths. And you can see the blue is people in the US, and then the red is specifically American Indians. And we started to see a decline. We're still watching this. You know, we have to make sure it's, before you declare something a trend, you want to see it over time. And then for young people, it is the second reason why Native youth die. And when, you know, kids aren't supposed to die, they're supposed to grow up and live long, healthy lives. But if you look at the number of youth deaths, a quarter of them are from something that is potentially preventable. So that's a staggering number that we might be able to do something about. We also have seen a dip recently, but again, we need to see the data over time to see if it's a trend. And you can see this, all those different colors represent different ethnic groups. American Indians, Alaska Natives have the highest rates of suicide compared to any other race or ethnicity, and it disproportionately affects, this is the gray line, disproportionately affects young people. So there are higher risk populations, not only by race, but also LGBT individuals with neurodevelopmental disorders like autism, kids in the child welfare system, anyone in a detention center, people in rural areas are all at higher risk. And we think that universal screening could really decrease these disparities because it gives everyone a chance to be identified for further care. So these are some of the high risk factors for suicide. I'm not going to go through all of them, but I highlighted the most potent one is previous attempt, right? So we have a saying in psychology, best predictor of future behavior is past behavior. This is absolutely true for suicide. Anyone who has attempted before is at greater risk for attempting in the future. And we're going to talk about that because one of the questions on the ask is, have you ever tried to kill yourself? And we're going to go into more depth about people who answer that question positively. Having a mental illness is also a high risk factor for suicide. However, not everyone who dies by suicide has a diagnosable mental illness. There was just a paper in JAMA in the fall that showed that 60% of youth who died by suicide had no diagnosed mental illness. That's a staggering number. And that's why universal screening is so important. And then medical illness is a risk factor that's often overlooked. Okay, so these are risk factors. I will tell you that most people who have these risk factors are not going to die by suicide because they're just risk factors, right? So if you were a triage nurse in an emergency department and someone came up to you with the risk factors for a heart attack, let's say they had a family history and they were obese and a smoker and high cholesterol, high blood pressure. If they walked up to your desk, you would not think they're having a heart attack. But if they came in with the warning signs of a heart attack, let's say they were clutching their chest in pain and sweating profusely, those warning signs would make you think they're having a heart attack. We think of suicide like that too. There's warning signs that are really important to pay attention to, right? So the first one seems so obvious, someone talking about wanting to die or kill themselves. But this is a warning sign that's often overlooked, especially in young people, right? So we try to take talk of suicide seriously whenever somebody's talking about it. Or someone who's looking for a way to buy a weapon where they weren't doing that before, feeling hopeless, trapped, or like you're a burden, or increasing the use of drugs or alcohol, acting anxious or agitated, or the signs of depression, sleeping too little, too much, being isolated. These are all warning signs that someone might be at imminent risk for suicide. So we pay attention to all those warning signs.